Posts on social media are spreading like wildfire, claiming that hospitals might be playing the system to get more money from the government. The claim comes from the CARES Act, which pays hospitals an additional 20% on top of traditional Medicare rates for COVID-19 cases. There are allegations that hospitals are claiming patients with other terminal diseases died from COVID-19, thus gaining them more government money. These claims, however, are completely unsubstantiated. Gerald Kaminsky, a senior fellow at the UCLA Center for Health Policy Research, says this is an outrageous claim. He says it is basically saying physicians are violating their Hippocratic oath. It would be like providing heart surgery on someone who doesn't need it. With no evidence to back up these social media posts, these assertions are nothing short of a conspiracy theory. Hundreds of people sharing this allegation as fact with no evidence goes to show the power of social media to spread and misconstrued false information. Julie Altman, a member of the editorial board of the American Medical Association's AMA Journal of Ethics, said it's very unlikely that physicians or hospitals will falsify data or be motivated by money to do so. There are strict policies for reporting and, quite frankly, healthcare workers are only focusing on helping their patients and doing as much as they can with little resources. In fact, the number of COVID-19 cases might actually be undercounted. In New York, the number of deaths is more than it was at this time last year, meaning there are excess deaths that are unaccounted for. These deaths could be uncounted COVID-19 cases. On top of that, hospitals' revenue is actually down this quarter because they're unable to perform routine work and elective surgeries due to COVID. This is why the government has stepped in with the CARES Act to pay them the additional money to compensate for this. So hospitals getting paid more for COVID-19 cases actually makes sense. It's no scandal. And if a patient goes on a ventilator, the hospital would need more money to care for them because they need more complex services. So it makes sense that they'd get paid more money for patients on a ventilator. The original post on Facebook claiming that the hospitals were doing this actually was flagged by Facebook as misinformation, and hundreds of people shared this without fact-checking. With hospitals unable to perform their routine elective services for income, the government has stepped in with the CARES Act, giving hospitals an additional 20% for COVID-19 patients. This compensation is no scandal. It was intended to be used utilized as a stimulus system put in place to help the struggling practice. A claim on social media that practitioners were upcoding patients for monetary gain was perpetuated. However, with strict reporting policies and no evidence for these claims, the conspiracy was falsely spread across social media. Given that the wildfire rate at which such misinformation tends to infiltrate networking platforms, the public needs to take care when reading things online, as they could be, and often are, false.